today we have a really interesting guest with us, Dr. Kriti Anand. I'm extremely happy to have you on board, ma'am.
Thank you.
So I'll move forward by introducing you to our audience so that they're as excited as I am. So I'll just tell you how wonderful she is. So Dr. Kriti Anand has established herself as a young and a dynamic psychiatrist. She has been doing it since a very long time. And she's not only a psychiatrist, but she's also an MBBS as well. And her experiences and her way of treating people will help us today as well. It's an immense pleasure to have you, ma'am. Please share a few words about yourself to our audience.
Hello, everyone. As she introduced, I'm Dr. Kriti Anand. I have done my MD in psychiatry, and I have been practicing since more than 6 years in this field. And I have been seeing many patients with mood disorders, anxiety, and de-addiction as well. And I've been lucky to be invited in many panels in many multiple news channels, and I've tried to reduce the stigma which is associated with mental illness. So this webinar will also be towards how we can decrease the stigma which is associated, and we can ask people to come up with their problems so that it can be sorted a bit easily.
Right. So the one and the most frequent question that pops out my head is like, you're a psychiatrist and you know every tips and tricks. So have you ever suffered from any COVID phobias or anything that has affected your mental health?
My mental health.
Yeah.
No, luckily I've been quite lucky in all this matter. But yes, it can happen to anyone. I have been seeing many patients with COVID phobias, and luckily I have been okay to deal with their problems and sort their problems out. And I have not have any symptoms of COVID phobia or any other psychiatric disorder. But yes, surely the patients are increasing, and there is less stigma as compared to 2 years back about mental illnesses. People are coming forward with their problems, and people are coming and opening up and asking about their queries quite openly as before.
So let's move forward. One question that comes to my mind a lot is that true that COVID has become more of a mental threat than to a physical threat during the current Omicron period when it comes to the COVID era?
COVID has been affecting us both mentally and physically. Yes, physically it needs to be, we need to be physically fit for fighting COVID, but mentally we need to be stronger because as nowadays what we say ki infodemia ho gaya hai, or we are exaggerated with information basically by social media or by news channels. They are creating so much fear every day, rising numbers and mortality. And the most searched Google topics nowadays are COVID related fear or anxiety or mortality rates or unemployment, which is leading to a lot of mental stress. But yes, if we see the gray lining, Omicron is less dangerous or has less mortality rates. But yes, both physically and mentally, we need to be very strong to fight this COVID era.
Absolutely. And somehow I believe it's just more in the head than actually in the environment. Would you like to comment on that?
No, it is in the environment as well. We are seeing COVID patients quite frequently. But yes, what we say is COVID phobia nowadays, we have terms. It's obviously increasing. And because of COVID phobia, the fear is a lot. Fear of contracting illness, and people have started getting anxiety bouts, or people have started fearing about their employment, about financial things. So it's there also. As in every pandemic, it happens. Fear, anxiety, and worries are the psychological consequences. So the same is happening in COVID as well. So it's both. It's both a reality, and as we can perceive it, yes, mental illnesses obviously increase with any pandemic. So as expected with COVID also, it's increasing.
So moving on to the next question. As we know, lockdown is a key source for us to put a stop on COVID and rising cases. Do you believe that lockdown is also a key source for mental health illness to occur?
Yes, obviously lockdown or social isolation, what we say, ये सारी चीजें जिसको हम कहते हैं, ये ज्यादातर negative connotations हैं. This which leads to fear and anxiety. Nobody wants to be, lonely, or nobody wants to be at home. We are, we are human beings. As human beings, control is a major part of our life. We want to control everything. We want to control what we eat. We want to control what movie we'll watch in this weekend. Where will we go out for vacation maybe next month? So yes, a change in all that, and change in not being able to control, and social isolation or COVID waves which are coming, and both. So this is a major cause of fear and anxiety and depression as we are isolated socially.
Exactly, I truly believe that, and I think the current COVID trends and the things have increased a lot of mental issues in people, and people are suffering from more depression as per recent surveys by Times of India. Moving on, when it comes to a person who lives with phobias, how does that person feel? What exactly is the terror on his mind and heart? What does the person go through? I just really wanted to know from a psychiatric perspective, how does that exactly feel?
So basically, what COVID phobia is, it's the fear which extends to beyond falling ill. Like the patient starts complaining that हम मर जाएंगे, या हम मतलब हमें डर लग रहा है कि हमें कोविड हो जाएगा and we'll die, or we'll be unemployed because of COVID, because of financial crisis happening. We'll be unemployed. We won't be able to take care of a family, or our family will suffer of COVID and they'll die. So basically, it's the COVID phobia or coronophobia, what the researchers have termed, is basically an excessive triggered response. That is like fear of contracting the virus, which can cause COVID-19, which leading to excessive concern over psychological symptoms. Like patients have started feeling, agar thoda bhi gala kharab hai, ya if they are sneezing once also, they've started feeling that nahi 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 humko to COVID ho gaya hai. So they're bothered. There is an excessive concern over physiological symptoms, and people are monitoring their oxygen levels, oxygen saturation levels very very frequently as before, and they are quite acquainted कि अगर breathing difficulty हो रही है तो हमें COVID तो नहीं हो गया. So there is obviously a significant stress about the personal and occupational loss. There is increased reassurance and safety seeking behavior. Like the patient, obviously, whenever the patient is exposed, the patient बार बार doctors के पास जा रहे हैं, बार बार they are getting themselves test if they are having even a slightest of symptom, and they're starting avoiding public places and situations which are causing marked impairment in daily life functioning. So all these are basically what we are seeing nowadays as COVID phobia.
Right. And as we said that people, as you said, you quoted that people are extensively checking their oxygen levels. If they're sneezing, they want to. Do you think this fear is just created by us, our society only? Because the fear that, oh, that person's sneezing, I need to get away. I'm going to catch the flu. Do you think this is created by us only?
Yes, obviously, this is created by us. This is created by, unfortunately, the social media and the news channels. The fear, the excessive fear. Yes, we need to be acquainted that COVID is there, and we need to take precautionary measures related to that. But excessively, if we keep bothering about that we might catch a flu, or what will we do about it, and that increase the reassurances or increase visits to the doctor, I think that won't help, and that will increase mental illness burden on our society rather than decreasing it.
Absolutely. As you said, like for a generic person like me who's not from a psychology background, and somebody like you, do you also feel sometimes the fear that, oh, this person coughed in front of me? Is there some sort of fear that you also face? Like, but you're a practitioner, but do you feel there is something there? Oh, this person is
So
feeling that.
obviously, as clinicians, we are quite aware of the symptoms. Yes, sometimes that happens to us psychologically also. That if we have a sore throat, we have a tendency to get checked and isolate ourselves so that we do not affect our family members or we do not affect our patients related to it. So yes, that obviously comes as a part, but the recurrence of it, or if your life functioning is getting affected, then it is a problem. A little bit of fear and anxiety is quite normal, which comes along with the pandemic. That is so obvious. But if it's too much, if it's in excess, if you're too fearful, if you're not able to go out, you're not able to shop your normal groceries, if you're not able to fulfill your functioning,
Right.
then it is a problem. Then it needs to get checked and treated.
And how extreme can these fears get to? Like, how extreme that a person can be when it comes to these fears?
I saw a patient who became literally agoraphobic. Like the patient had fear of COVID that much that the patient was not even able to go out to buy their groceries or buy their normal things, and they used to sterilize everything and repeated hand washing, which was causing the blisters in their hands. So it might get really excessive to a background that the person might not, there will be impairment in social occupational well-being of a patient. So I've seen that kind of excessive symptoms in a patient also, who was so anxious and was getting recurrent palpitations and breathing difficulties. And the patient thought that the anxiety, the breathing difficulty due to anxiety, uh, वो उनको लगने लग गया कि it's because of COVID. The
Oh,
patient started rechecking themselves, getting multiple tests, and not getting reassured that he doesn't have COVID. Uh, Rather, he has anxiety. So he got referred by a pulmonologist to me. So, yes, it can get quite excessive.
absolutely. Shall we move forward?
Yeah, sure.
Yeah. So when it comes to a practitioner, you know the key terms, you know everything that if that is happening, the person is suffering from here. How can I can self-diagnose myself that, oh, I need help or I'm not able to do the things correctly, or there's some or the other thing that's happening in my head. I need to go visit somebody like you. What exactly should I do to self-diagnose myself?
So, whenever we are diagnosing ourselves of anxiety or phobia, the main symptom of diagnosing ourselves is basically excessive fear.
Right.
If it's that excessive that we have other physical symptoms such as palpitations, tremors, breathing difficulties, sweating, अचानक से tremors, मतलब अचानक से ठंड लगना या अचानक से गर्मी लगने लग जाना, ये सारे पैनिक के सिम्टम्स हैं, एंजाइटी के सिम्टम्स हैं. So अगर ये excessively ज़्यादा हो रही है या there are disturbances in sleep or disturbances in appetite, then we need to get it checked. And again, if that is enough, that is affecting us so much that we are not able to concentrate in our work, we are getting irritable, we are not able to enjoy being the family or enjoy things that we usually used to do, then we need to visit a psychiatrist or a psychologist and get treated or get therapy or get medications, whatever the specialist says.
Absolutely. So just to self-diagnosis, to introspect ourselves properly so that we know if there is any discomfort, we need to visit the right person.
Yes.
Moving on, and sometimes a person is weak enough to get to know the fact that, oh, he's not able to judge the right thing that I'm suffering from this. How can family and friends come to a role in improvising and judging and introspecting the person? What role does the family play in that?
Family and friends have a major role in any psychiatric diagnosis, as we all know that we need a strong social support to deal with psychiatric disorders. Unlike like in physical illnesses, always obviously you need someone to take care of you, but in mental illnesses you need someone to be supportive enough to understand what you're going through and to lead you towards a गुड पाथ बेसिकली. कि अगर अगर आपको लग रहा है कि आपके कोई फ्रेंड्स हैं या अगर आपके कोई फैमिली member, they are having excessive anxiety or they are having palpitations or they are getting very worried about COVID, excessively worried, and they are always watching the news channels, and they're not able to work or not able to concentrate on anything or getting excessively irritable, or there is a disturbance in sleep, then we need to help them, we need to console them, and we need to take them to a mental health professional who can deal with these problems in a better way.
Now,
But
once
social support is really important.
absolutely. Once the person is diagnosed, and then is also a role played by a family as well, and what things that they need to do after the person is diagnosed with the fact that he or she is.
After the person is diagnosed, like I told, there should be an empathy, there should be an understanding. Many people do not understand mental illness as they understand physical illness. Many people say, ki, nahi, nahi, you need to go out or you need to ignore these things. But people need to understand that this is also a disorder, this is also an illness which needs to be cured in a better way. And if the patient is suffering through it, then the patient needs to be managed in a better way, in a more practical way. We need to understand what the patient is going through, and we need to, do not defy things that, you should do this, you should do that. You should not take treatment, ayurvedic दवाइयाँ ले लो या walk कर लो या meditation करो बिल्कुल ठीक हो जाएगा. So every person is not the same. We need to understand. As family members also, we need to understand that everyone's coping mechanisms are different. If someone is stressed about something else, then might be that you are strong enough to deal with that thing. So we should not compare as human beings, and we should have empathize. We should understand what the other person is going through, and as friends or as family members, this is the major role. You can just be for that person. You can just support that person through that difficult time.
Absolutely. Moving on, what do you suggest? How does a person feel once everything is sorted out and he's done the therapy, he's overcome it? What exactly is the state of mind then? Does he
When the patient is okay, matlab when the
recover from the mental
when
health issue?
the, usually what happens is when a patient presents to us, then we see that the what is the severity of basically that anxiety disorder,
Right.
and accordingly we deal with it. There are therapy sessions or there are medications, whatever we feel that is required for the patient, we give. But once the patient is recovered through it, the patient regains back the quality of life, and the patient is able to function in a better way in all social environment or all occupational or employment basis. So the patient becomes as before. जैसे प्री मॉर्बिड कंडीशन में होता है पेशेंट वैसे ही हो जाता है.
Right. So moving on to the little fun question. Do you believe Google is the new psychiatrist in town?
Yes, Google was always a big psychiatrist in town. So I need to, we need to understand that Google is, just 10 or 15 years old, and we have been studying throughout that while. So yes, people self-diagnose themselves. That is a very bad thing. What is happening if you search any, like for example, if you search headache, there will be, even worse diagnosis coming, like even egg cancer, brain tumor, happening. So you need to understand that Google is just an application in which code words are being scanned. It's not a doctor who can understand or subjectify your problems.
But I think we as Indians have made it as a perfect psychiatrist for all the issues, any health related, it's there. Never goes away.
Totally. That's an easy way out. You do not want to go to the doctor. You just want to self-diagnose yourself and calm yourself down. So majority of the times, you do not calm yourself. You just increase your anxiety and get all worried about that what's wrong is happening.
So why is there a need that as an individual I need to go to Google? Why can I go to a psychiatrist? I think why is there so much stigma in our country when it comes to a psychiatrist? If I'm coming and visiting you, oh, there's a problem with me. If I'm going to a physician, then I'm fine. If I'm bukhar, it's fine. But if I have anxiety, it's a terror that I've done to the country.
See, that's what we are trying to reduce nowadays. The stigma associated with psychiatric disorders is age old. So it's in centuries. ये बहुत पहले से है. Even in abroad, psychiatrists have been called as shrinks, and the treatment can cause shrinking in the brain. So these are myths which are related with the psychiatrists, unfortunately, and this will continue. People do not understand. जब तक लोगों को ये नहीं दिखता कि टेस्ट में कुछ गड़बड़ आ रही है, तब तक people do not understand that what's wrong with the person. So in physical illness, if you have a typhoid, if your blood pressure is increased, if you have hypertension, if you have diabetes, you can see your BP rising, or you can see your blood sugar rising, or you can see your CBC rising, or whatever it is. But in psychiatry, you do not, you cannot, you do not have that test. You just have test, obviously, a hair psychological test hai,
I
but
don't
you do not have. Yes, you do not have bodily tests which can show the serotonin level, or which can show that you're not happy, and there is something wrong going. So obviously, the stigma is, as human beings, we do not understand what we cannot see. So, or what we do not feel. So we try, हम दूसरों को समझाने की कोशिश करते हैं. But once the person, feels what the other person is going through, or gets that thing, then they stop stigmatizing about mental illnesses, and they come forward. I have so many patients who have got themselves treated in a better way, and they are getting their friends and family members also for therapy, or also for treatment, because they feel that quality of life is much more important than only the quantity of life.
Absolutely. Moving on, it's a personal question to you. When you were opting to become a psychiatrist, do you feel there was some stigma on your head as why you're doing that? You're an MBBS, you can be a cardiologist or something that fancy.
During my MBBS also, I mean, I was very interested in psychiatry. It always fascinated me as a branch, because it's so much to say, and it's such an empathizing branch, and the people, the emotions are so much. Yes, obviously, people around me were also stigmatizing that if you do psychiatry, pagal ho jaogi. So, but no, whoever takes gynecology or whoever takes obstetrics, that doesn't get pregnant. No? So it's like, aisa nahi hota. That doesn't happen. But yes, you need a very strong head to listen to people, to understand their problems, and to give them good advices. And I have so many patients who are coming to me, and after 20 days or 30 days, when their therapy is successful, or when their treatment is successful, coming and thanking that they are happy again, and they do not have anxiety issues, and they are able to work well. So all these things, give another sort of happiness, or give another sort of, basically, you feel good about yourself, that you are doing so good for your patients and other people.
Yeah, so I strongly feel that psychiatrists, psychologists, and all the other generic physicians and all category of doctors should be treated the same, because I think it's absolutely the same. They're treating something. It doesn't depend if it's in your head or it's in your body. It's just the same. I think we as Indian needs to believe the fact.
Obviously, we need to understand that quality and quantity of life both are equally important. If you increase the quantity of life by treating yourself, मतलब आप stent लगवा रहे हो, आप सब कुछ कर रहे हो, you're not able to enjoy your life properly, you're not enjoy small happiness in your life, then I don't think that there is any कोई महत्व नहीं रह जाता जीने का फिर. So that is why it's as important to be happy.
So moving on, thank you so much for being here. I had a wonderful session. It didn't feel like a session, it just felt like a chat show. Actually, not even a show, just like a basic chat with a brilliant doctor like you. So I hope you had a great time, and thank you so much for being here. Any final thoughts?
Thank you. No, thank you, Kavya. It was a pleasure being there. It was a nice questionnaire. I mean, getting into personal levels also. It was fun. Thank you.
Okay, have a great day. Bye-bye.
Yeah. Bye.
Bye-bye.